So Sitaram Bhartia Institute of Science and Research is a 70-bed non-profit hospital and medical research center located in South Delhi. As a non-profit organization, our fundamental mission, our fundamental purpose of existence is to help improve society. And we try and do this by taking up those projects that public organizations are unable to take up and private organizations are less likely to take up. So an excellent example of our work is in maternity care. For the last 12 years, we've been focusing on reducing cesarean section rates. Now, government hospitals cannot take up a project like this because they are overwhelmed by high numbers, whereas private hospitals are also not able to take up a project like this because of its complexities and because sometimes there are perverse incentives operating. As a hospital, you actually get paid more if there's a cesarean versus a normal delivery. So this is, and at the same time, we know that there are too many cesareans happening in our society. So this is sort of like the perfect spot for Sitaram Bhartia to do. We must reduce cesarean sections because that's the need of society. Public sector hospitals are not taking it up, private sector hospitals are not taking it up, so a non-profit like us is stepping in. And not only are we working to improve care within our own hospital, we are very interested in knowing what's happening to care on a citywide basis. So as some of you might know, we've recently completed a citywide survey of maternity care, which was funded by the Indian Council of Medical Research. We knocked on 118,000 houses all across Delhi, and we've produced a maternity report card that's now been published in the British Journal of Obstetrics and Gynecology. And we are trying actively to disseminate findings of that study so that it can spur debate and begin to move our system towards more evidence-based, woman-centered care. You know, the values in many organizations are something that just sit on a wall or on a web page. We are trying to build an organization that truly lives by our 4 core values that I've articulated. One is to always put the interest of the patient first. And that unfortunately doesn't happen in healthcare as often as one would expect. The other is to build an organization where there's continuous learning and improvement. They kind of are linked together. If you want to always do best for patients, you need to keep improving your service levels, you need to keep making sure that your care is aligned with the latest available evidence. That requires continuous learning and improvement. And the third is treating others as you would want to be treated yourself. That goes for patients, that also goes for people within the organization. And lastly, it's institution building. You know, I went to America to study at age 17. And one of the things that struck me about America, and now when I travel to Britain, is the health of the institutions. The institutions in Britain are centuries old, in America are 100, 150 years old. And despite the elapse of this long period of time, they are excellent, they are vibrant. This is quite in contrast to Indian institutions that often go sick by the time that the founder has passed away. Right? So we've articulated as a 4th value institution building. Can we create something that will have a legacy even after we are gone?